Hello, and welcome to the Clubhouse, a Peak+Prairie Health Promotion podcast. I'm your host, Megan Hunter. I'm so glad you decided to join us today. You are welcome here, and everybody belongs in our club. Welcome to our very first episode. I am thrilled. I've been so excited about this for some time now. And we're cutting it a little close. I did say July, and it is July 31st. So as promised, here's our first episode. And it has been a true delight to focus our very first session on an amazing health service here in Canada. We're looking at the Canadian Health Advocacy Incorporated with the founder and CEO, Paige Lennox. Paige and I had a conversation using Google Hangouts, I believe. So I wasn't able to have total control over the mics. So the sound quality is definitely a learning point. So I'll just leave you with that on the way in. But I do look forward to hearing your thoughts and to see what you want to hear about in upcoming episodes, who we might want to talk to, and also just your overall impression and feedback on the amazing information that Paige has to share with you all. So thanks again, and here's our very first episode. We have our guest, Paige Lennox, who is the founder and CEO of Canadian Health Advocacy Incorporated. She is a nurse of 26 years who's turned entrepreneur because of a gap that she identified in the system. So Paige, welcome. How are you doing today?
Hey, Megan. Great. I'm good. Thanks. Thanks for having me on here.
Absolutely. I'm so excited for people to hear what you're up to. You've got lots of things in your back pocket to share. I always like to start my podcast with a couple of questions so our audience can get to know you better and that we can have, conversation as old friends, even though we may never meet in person. So my first question would be, what do you feel is the most exciting progress that's been made in health and wellness so far in your career?
That is a tricky question, especially because we're in this pandemic. I would say probably the movement towards digital health and the use of technology. I think especially, it's really proven to be a huge help during this pandemic for people to be able to still connect with their healthcare providers. So, and that's been how it's kind of been trending that way for a while. And I think there's a lot that can be done with the use of technology. Obviously, we still need the personal touch and the contact, but I would say that's probably the most progressive and exciting thing that I've seen.
Wow, it's so true. And what better timing had this pandemic happened before we had the capability to video conference or even do a video podcasting recording? I think our lives would be quite different right now.
Absolutely. Not to mention the people that are sick right now during, and I don't know what would have happened.
Yeah, I definitely agree. Oh, that's a really good one to highlight. The next one is, and you don't have to answer this one, but do you have any beef with the industry or something that you think we can do better at?
Oh my goodness, I do. I mean, I'm still working as a nurse as well, and so there's a lot. Our system has a lot of strengths. We have a free health system. However, it's very basic, and I think we can all agree there's some massive gaps in our system. And I think the big piece is communication. There seems to be a communication break and challenge between healthcare providers, between different healthcare providers, and then the patients and their families. So,
yeah.
I mean, and also there's, I don't know if that's a beef, it's just sort of a fact.
Absolutely.
There's more patients than there are doctors too, right? A lot of people just don't have family doctors, and that's a big problem as well.
Yeah, those are really important pieces. And I think communication is something across industries that we can all be better at. And as we have more tools, it's how can we find ways of spanning communication across sectors? So I think that's such a valuable point. Thank you for bringing it up. All right. So here's some more personal ones, less about your your professional life here. What is something about you that many people might not expect?
Oh, that's easy. I play the banjo.
What? You play the banjo?
I do.
Tell me more. When did you start?
I guess about 12 years ago now. And I'd never played musical instruments, and I love the sound of it. It was a happy sound. It's pretty hard to frown when you hear the banjo. And so, yeah, I went and got a cheap one at a pawn shop, and then just started teaching myself and started going to festivals and picking people's brains. And yeah, and I've since played in several bands and done some recordings, and it's fun. It's a fun instrument. I
Oh
also
my.
play the big stand-up bass too, and I'm not that big, so I've chosen the biggest instrument, and then the banjo's really heavy because it's got lots of metal in there. So I've chosen the heaviest instrument and the biggest instrument, but they're fun, so fun.
Oh wow, you really are full of surprises. You might need to share a link of any of your recordings. I'm sure we have some ears perked up on that one. That's amazing, Paige. Wow, I didn't know that about you. So yeah, got me. Oh man, to that point, it's funny. I had a band teacher in junior high who was just like, yeah, probably about the same size as you, and she played the tuba. And it was just hilarious because she'd have all these junior high kids saying their flute or their trumpet was too heavy, and she'd sit up on her stool and hold her big old tuba and look like she's gonna fall over. But yeah, hilarious how we choose these things, eh? Oh, there it is. There's the banjo. Oh,
Yeah.
I wish you could see this. It's amazing. All right. Well, that's wonderful. So I'd like you to finish the sentence. One of life's little pleasures is.
Oh, and I'm all about simple pleasures. So there's such a long list. Oh, there's so many. Just walking. I'm a fan of nature. I spend as much time out there as I can. It doesn't get more simple and basic and real as that for me. So whether it's sitting by the lake and just being present and just being there, or walking in a path in a forest. Those are some of they're just simple pleasures, but they're big.
Oh, definitely. And you live in one of the most gorgeous regions in Canada or the world. Um,
I live in Nelson, BC. And I also live on the side of a mountain. So I'm very, very lucky.
oh, it's almost very European of you. Most people live in the town below the mountain. So, why? And finally, what are you most grateful for?
Oh, again, there's such a long list. Well, when technology works, I'm living on the side of a mountain.
Fair.
Oh, I would say my family for sure. My nephew in particular. Yeah. But I have a long list of things I'm grateful for. It's a really good practice, I think, to touch on that on a regular basis. All the amazing things that we have rather than what I don't have. So yeah.
I couldn't agree more. I know I'm very grateful that our paths have crossed.
I know.
It's been so nice.
Absolutely. I love it.
Yeah. Well, and so now that we know a little bit more about you, why don't we check into some of the cool stuff you're doing to make this world a better place? Because I don't even think I could list it all. I swear you have so much going on. So, what is a health topic or something that you're passionate about when it comes to public health or the health of Canadians?
Yeah, well, that's sort of the basis of of my business is advocating for patients that can't advocate for themselves, helping people navigate the healthcare system. And so, how I kind of came into this. So, I've been a nurse for a long time, 26 years in the hospitals, settings, and saw lots of people falling through the cracks. I've always been drawn to advocating for my patients, but always a little bit confined within the hospital because, just because. And then I was a caregiver for my mom who had terminal cancer. And then my dad and a couple of good friends of mine. And I knew what questions to ask and who to ask them to. And it was still a struggle at times to get the right answers and to get the right care in place and to find out. And I was at a distance from them too, which was a challenge. And I just started thinking, what do people do that don't have a nurse in the family, a doctor in the family, or someone that, with a personality that knows to advocate? I mean, the majority of people don't even know it's okay to ask questions, let alone get a second opinion. And so I just was talking to some entrepreneur friends of mine over coffee, and they said, you've got some really great ideas, because I had looked for advocacy work outside of the hospital, and there's nothing in Canada, or there wasn't. I started a year and a half ago. At that time, there wasn't. And so it's a really new niche in Canada, and it's really common in the States. There's a huge association. It's an actual profession down there. They've got credentialing, standards of practice. And so I decided to start my own up here with the help of my entrepreneur friends. So I truly am a nurse turned entrepreneur. It's been a huge learning curve, but I'm loving it. And since then, it's been growing organically. We have a team of advocates across Canada. We do virtual work with people, which has been really handy during COVID, and just trying to reach as many Canadians as we can to help them.
Absolutely. That's such fascinating work. And when it comes to the association, is there an association in Canada, or can you tell me a little bit more about how somebody would become a health advocate and what those standards look like?
Right. Well, we don't have standards in Canada as of now, but I'm co-founding an association here. Actually, there's myself, a doctor in Ontario, and a woman in Edmonton. And we're co-founding an association. So we're in the early stages. We have a website. We're now building a team. We've reached out to people doing similar work across Canada. And we're just working on getting some funding. And so that's and some credentialing, standards of practice, and that will hopefully, it'll come sooner rather than later. So it's really exciting. We've gotten really great feedback. We've gotten, even with my business, amazing feedback from the doctors and other healthcare providers, because we can take a lot of stress off of their workload too. And they've been really appreciative of our presence in appointments and such.
That is amazing, because I the first question that comes to mind is, what does that look like, being a health advocate, and how would you work with a healthcare provider to enhance the patient care? And what does that look like? Is it more collaborative? As I don't see you as a competitive person. So I see this being your business coming in and enhancing the healthcare system. Although I know some people could see it as competitive, but can you speak to that a little bit?
Sure. And I mean, I think, like with anything, presentation is everything. And so our goal is to be very collaborative with the doctors. And so just, we essentially we're not working hands-on care as nurses, we're working as consultants. And we're helping support the family, and supporting the doctors as well. So we kind of become an extension of the family is sort of how we describe ourselves a bit. And we happen to have medical knowledge and healthcare knowledge too. So we partake in most of the doctor's appointments. We help with end of life care and planning, advanced care planning. We can help with CPP disability forms, following up on referrals, requisitions, and we act as a link between all of the different silos of, whether it's 5 different specialists that are involved in a person's care. We can kind of be that hub for communication. So, but yeah, I mean, it's as far, we definitely, a couple of times I've had to bring out, I call it my bulldog, where I'm a little bit, I'll say, actually, Dr. So-and-so, that's not okay that, you're talking to that person that way, or we actually need these questions answered. But usually you get far more, it's way better just be nice. I guess is what I'm trying to spit out.
Yeah, absolutely. You catch more flies with honey.
I'm trying to think of that little saying.
Yeah. You catch more flies with honey than vinegar?
Something like that.
Yeah. Oh, I could see that being so helpful. I love how you said the multiple doctors and specialist appointments, because the more complex a health concern, there's contraindicators. So you end up with maybe a few different specialists working on the same person or the same case. And I'm not sure about you, but when I think about not feeling well or having a family member not feeling well, it's so stressful just to be sick, let alone start learning terminology, medications, instructions that maybe you've never done before. And I could see that being overwhelming if um, even if somebody close in my family wasn't feeling well, it'd be so stressful. And you're so in it and just caring about that person, that following and remembering all those instructions could be really difficult. So that sounds like such a compassionate occupation that you've created.
Oh, thanks, Megan. Yeah, it's really exciting work. And it's interesting, there's some stats that you and I who are healthy, we only retain 17% of what is said in a doctor's appointment. And so and then the next stat is if you're not feeling well or you're older, maybe have a bit of dementia, that goes down to 3%. So really, really important. I mean, doesn't have to be us, but to bring somebody with you to your doctor's appointments, to be that extra set of eyes and ears and take notes. Go in with some questions and then take notes.
Absolutely. And almost having that objective eye to having somebody who's on the side of your family, but because they're not in the details of the family dynamics, it would be nice to have that voice of reason, I would imagine.
Yeah, we are objective. And I mean, most families have their dynamics and those just get amplified when there's a health concern with a family member. So we can be peacekeepers too, and just or help with that communication or be a buffer if that's needed. So yeah, and it's also interesting that you talk about, your family members, because probably most of our clients are in the sandwich generation and they hire us to help with their aging parents. They've either got kids at home, have a full-time job, and they're at a distance from their parents. That's really stressful. I've been there. I was that way with both my parents, and I would have loved to have somebody locally to be there with them.
Oh, just somebody who could check in on them or be at the doctor's office. I know it's a little different with COVID right now. How has the pandemic adjusted the way in which Chai helps its patients?
Yeah, well, thankfully, pre-COVID, we were doing a lot of virtual work already. So COVID actually helped in that regard because now more people are open to the idea that they can still get their healthcare needs met virtually and not face to face. So they're more open to that idea. It definitely slowed things down for a couple of months. So we just took that opportunity to work on a few projects and work on the website and do a few things so that come out strong on the other side. And now we're starting to get busy again. But during the heat of the pandemic, we did a lot of pro bono work, all of us, which was great. It was our way of being able to help. And we were getting a lot of calls from family members in parking lots of hospitals, really, really anxious and stressed because they couldn't go in. And so they had brought their loved one to emergency. They were admitted. They had no idea what was going on. And they couldn't get through to the hospital staff. So we were able to just make calls into the hospitals and sort of be that liaison between what was going on with their loved one and them in the parking lot. So, because the hospital staff, I mean, it's busy for them and they can't reach out to 5 family members for one patient. Like, it's just not even realistic. So, yeah. So it's been interesting, and it's not over. It's still chugging along, this pandemic, and we're just gonna have to go with the flow. I guess it's not gonna be, there's not gonna be a final end to it.
No, I think it's we're looking at a new way of life, less so than the pandemic ending, right? Yeah, not to be too doom and gloom about it, but this might just be the first of many different global health issues that we see, or I should say, puzzles that we see in the future that we'll have to be figuring out as connected and collaborative health professionals across the different fields. So it is nice to know that there are health advocates who can help identify the roadmap just for your own personal family, knowing that there are these bigger scale issues going on. It would feel good to know that you have somebody at your side when you know that your doctor and the nurses in the hospitals are just so either overwhelmed or just trying to protect themselves and the patients who are there.
For sure. Yeah. And we can help, setting up some of those virtual calls for them and getting their medications delivered, seeing if there's other resources they need, like those kind of things too have been really helpful for people during the pandemic.
Yeah. Oh, that's wonderful. So when I think about your business right now, who does Chai serve currently? And second part of the question, where do you see Chai going in the future?
Yeah, so we started a year and a half ago. My intention was to help a few people locally, just kind of do my thing. And then we got the website through word of mouth, and we started getting calls from across Canada. So now we have a team of, I guess there's about 10 of us, advocates in different, right? We have people on Vancouver Island, and we have someone in the Maritimes. And so we have people in most provinces. And so we help. Our demographic is, like I said, the sandwich generation. We help individuals more and families. Sometimes you'll get passed around the family and help different members. And so it is for fee, right? It's a private service. It's for a fee. And that's the tough part, is we want to be able to help more people. So next steps is to scale this business grow it. And I think, and the best way we're going to do that is through partnering with big organizations and trying, and get coverage for people through their employee benefit programs, trying to get written into some of the bigger insurance company policies to get coverage for people, finding ways through CRA so people can write off our services at tax time under medical expenses. So that's a lot of the work that we're doing right now is is partnering and having those conversations.
Wow, that sounds amazing. What an incredible service that would be, as an employer, being able to offer health advocates to your employees. My goodness. I was, as you know, I'm doing a master's at the University of Alberta in health promotion, and I'm looking a lot at workplace and mental health and our job control and flexibility. A lot of the research that I come across is about stress and productivity.
Mm-hmm.
Yeah, and absenteeism, but also presenteeism. And presenteeism is defined as people who are at work, but they're not focused. They're distracted and they're not able to do their job because of the stress or other things going on in their lives. They're not fully engaged in their work. So it's an outcome of engagement. And what they're saying is things like sleep, outside stress are really quite impactful to presenteeism. So people are still showing up at work. It's not coming off your absenteeism report. People are losing, say, 1 to 5 days during the span of their stress. So whether that be 3 months or a year, so it can be higher than that. But you're losing that productivity of that employee because they are worried about something else going on in their personal life. So if you had a parent or a child who is sick and you were able to call a health advocate through your employer services to manage some of that stress, my goodness, all of a sudden you have an employee who's appreciative because they were able to access this service through work, and also they're more engaged in their work because they know that there's somebody who has their back, who's looking into maybe some of these conditions, or being able to go to the appointments that otherwise you'd have to take time off for. That's incredible.
Even things like making appointments, or checking, getting the results. And I know when my mom was sick, I was not present at work. I was present, I was there going through the motions, but as you're constantly wondering, well, especially when you're at a distance, well, when should I go? When should I, I wonder what's going on today. On my break, I need to phone the doctors to see what's going on today. And I totally relate to that. And so absolutely. And if I would have had coverage through my work, through my benefits to hire an advocate to be there and do those things for me, it would have been and then they can just keep me informed. Huge game changer. I wouldn't have had to take so much time off work. I would have, and then I ended up getting kind of run down, and you catch colds easier, and then you have to take time off work, or you're bringing, it just is a domino effect. And stress is huge. It's huge. So
Yeah, it really is. And it snowballs too, because once you get run down and you're stressed because of a certain event, it's harder to sleep. And once we stop sleeping as much as we need to, oh gosh, the research is thick on that one, looking at everything from our waistline to our mental health and how we think, all
yeah,
goes downhill. Yeah, we cannot make the best choices for ourselves when we're not well rested.
for sure. Yeah. I agree. So yeah, I would just love to be able to get, and then also we can help more people that way, because not everyone obviously can afford to pay for private service. And so it's also a way of helping more people in Canada too, if some of these bigger companies can support their employees this way.
Yeah. And that is definitely a theme I've noticed as our conversation has gone on. Your organization and the actions that you're doing all come back to helping as many Canadians as possible get the best care possible. And not just about the patients, but also improving the lives of our healthcare professionals. Because you speak to how do we make their jobs easier? If they have if you have a health advocate supporting the doctor's work, they're repeating less information. There's less missed appointments. There would be less dropped cases within the health system because you have someone who's there for that quality control and just ensuring that the patient actually understands and knows what to do next.
Yeah. Well, and because we're a part of the doctor's appointments, I think compliance is a big issue for prevention, right? When people aren't, because a lot of times if they don't really know why they're taking their medications, or they'll forget, bits and pieces of that, then they'll come back to their next appointment and they haven't done their blood work, or they haven't, just because it's not their fault. It's just maybe they have memory issues. Maybe they just were feeling so crummy that day they just couldn't remember, or they didn't write it down. So because we're a part of those appointments, we can help with that accountability piece, and we follow up with our clients, and did you get your blood work done? And then there's a whole prevention piece to this too, because then they're going to get the care they need in a timely way too, and they're going to be more compliant, which makes the lives of the doctors a lot easier. So I think it's hard for them too when patients aren't able to comply for
Yeah.
whatever.
Yeah, the adherence to a care plan, sometimes it's just not possible because it's either complicated or having someone to make that connection to why you're doing something. I don't know if you're anything like me. I don't necessarily like to be told what to do. So, but if I understand why I'm doing it and how it's going to help me and how it will prevent further health complications, I'm way more likely to understand why something is happening. And I think there's a lot of people like that. They want to be informed, and having a health advocate seems to fill that gap.
For sure. And it's also a cost saving thing too, right? Both for family members that maybe don't have to travel or don't have to, take time off of work. And then for the employers, they don't have to pay for their employees to take time off of work, or, and then on and on and on. So kind of starting from the prevention side, it's just cost saving for them too, for the companies.
Oh, for sure. So if I were an organization, and I know I run my own business too, so if I wanted to contact you, Paige, and find more about how myself as an employer could get a hold of you, who would be best? Who do you want to hear from an organization, and how would I get more information about this from you?
Well, ideally, somebody that's in HR, or the benefits, that has something to do with the benefits, I guess. People that, and we have a website, and I don't know if you do show notes.
Yeah, I will put it in the show notes. We will put it's for those of you who are audio, it's Canadian Health Advocates Inc.ca.
Yes. So I would go onto the website or contact me, Paige, at CanadianHealthAdvocatesInc.ca. It's kind of long, I know. And we also have an information package that we can send out to you too, if you're interested.
Wonderful. Oh, that sounds great. So in terms of a call to action for our listeners, what would you like anybody who's taken the time to listen to our podcast today? What would you like them to do to help support Chai as an initiative?
Yeah. Well, I mean, have a look at our website for one thing. Spread the word, talk to people, give me a call if you want to know more information. I'm always happy to chat. Um, yeah, that's kind of what that would be my call to action.
I love it. That's wonderful. So, Paige, thank you so much for your time today. Is there that's all for my questions. Is there anything else you wanted to add to our conversation today that I may have missed?
I don't think so. I think we covered a lot. And yeah, just really, really grateful to have the opportunity to support our system, our healthcare system in this way. It's really exciting.
Yeah, absolutely. And that passion comes through. I know you can't see her face from where I am. We're on a video call, and Paige is sitting there just glowing and smiling as she speaks to everything that she's doing. So her actions come from the right place. They come from the heart, and she's looking to make a difference, and she is making a difference in the lives of the patients that she's working with currently. So yeah, hop on Canadian Health Advocates Inc. .ca and check Paige out and her fabulous advocates. Definitely reach out if you want some more information, and I'll put Paige's contact and the website in the show notes. And that's all today, all for today. There we go. Thank you so much for listening. And yeah, we will check you later.
Thank you, Megan.
Thank
Great
you.
to meet you.
And there you have it. Episode 1. We did it. Wasn't Paige fabulous? I could speak with her all day. I so appreciate her passion and knowledge in the area of health advocacy. Well, we'll leave it there, as we have much more to talk about in many other episodes. So hit subscribe, leave us a review, share and tell all your friends, and be sure to reach out. We'd love to hear from you. And until next time, stay well and excellent, my friends.